and welcome to another episode with Nurse Amy. And I'm glad you're here because I'm here with you. And again, I just want to say thank you for all of those that have been with me from the onset of this channel. I've been saying, someone wrote to me, you said you've been wanting to change the name of this channel. That is so true. And I have not changed it yet. But someday I will. I need an assistant. That's what it is. Now, for those of you who don't know, you all know I'm into aesthetics now. So feel free to check out my other channel, Glam Care Academy. And I'm also on Facebook with that same name. For those of you who are interested in going into aesthetics, is a booming business, is a billion-dollar industry. And that's one thing I love about nursing department. Now, mind you, when I use nursing department, a lot of you, I've told you this before, nursing is not only about nurses, okay? You've got LPNs, you've got RNs, you've got CNAs, you've got GNAs, you've got SDNAs, okay? I would even say you've got housekeeping and laundry, though they have a different department, but it's all part of nursing. Why? Because we'll come together to take care of our clients. So one of the things I want to talk about today is someone wrote to me and asked me, is nursing worth it? Is it really worth it? Well, it depends on what you mean by that, what your expectations are. It is worth it. In my own opinion, it is. And we all have our different experiences. Some of us started from housekeeping and worked our way into caring, personal care of patients, and others started from CNA, and some went straight for the RN. It really doesn't matter where you start from. The focus or the center of it all is our patients, right? So, is it worth it? What do you think? I want people to write to me, put comments below, and let me know how long you've been in nursing department. When I say nursing, I mean CNAs and everyone that is part of the care of the patient. Okay, so when I say nursing, actually, I mean all of nursing care, excluding doctors, because then when we can use the word nursing on them, they're medical doctors. Okay, so is it worth it? For me, yes, it has been. I proudly, although grudgingly, and sometimes I'm really irritated by my badge of honor. What do I call my badge of honor? Well, my chronic pain. That is my badge of honor of the years I have worked in the field. I have been doing that since 2000. That's a long time to be a nurse. So the wear and tear on you, it's real. But at the core of it all is your care for your fellow human. Does that make sense? Yes. You care for your patients and your clients and your colleagues who will get on your nerves to no end. But then that's what we as humans do. We get on each other's nerves. Is nursing frustrating? Like any other job, it is frustrating. It can be. And it gets more and more increasingly so because there is such a divide. And I have said this on my channel before. So go ahead and check some of my previous videos where I have talked about there is such a divide between management and the clinical staff. Does that make sense? Because management is essentially driven and overseen by the business aspect of nursing, and then the clinical aspect is by the care providers. So you have one section that is totally driven by dollars or the dollar signs, and then the other side is what can we do for this patient. And then there's bound to be a clash. Unfortunately, the side that usually almost wins is the side of the money. That's just the way it is. You can talk all you want, you can get angry all you want, but the money makes things move. if we didn't have money, and they can argue this, we can get all the things and the tools and the services and the training that we need to take care of our patients. But then if you flip that around, if we don't have those patients, then the money isn't coming in, right? So yeah, it is. Is it worth it? It is worth it if that's your passion. I tell people this. Now, if you're coming into nursing or healthcare because you want to make money, there are easier ways to make money, really. The good thing about nursing is you're flexible, you're liquid. Does that make sense? Let me explain liquid to you. It means you can work in many places. So liquid and flexibility. Liquid as in you can get payment as often as you work. It doesn't mean you make the most money. And this really irritates me, because a lot of people think, well, when you're a nurse, you make all this money. Well, I tell you this, like I've done before. If you work 12 hours like I do in a day, and you have all these multiple shifts, well, it will add up. Even if you're earning $10 an hour or $5 an hour, or even if it's $1, it's going to add up. There are people who make more than nurses. There are people who make more than in the nursing department, and they don't work half as many hours as we do. I think that's an easier way to make money. I have students who have gone through my class, and they've been so frustrated working as a certified nursing assistant. They've gone back to doing other things like waiting tables, like working in the factory. And they've told me they'd rather do that than the BS they have to put up with in either in the hospital or in the nursing home, even working home health. So those are the things you have to look at. It's not about the money, it's because you care. Now there's so much your care can do, because eventually you get burnt out. Is burnt out real? Heck yeah. I'll probably do another video on burnt out. It is so real. I'm burnt out. A lot of us are burnt out. Actually, I think I have been getting emails on nursing burnt out, so I might do that. But anyway, is nursing worth it? I just wanted to tell you, yeah, it is. It depends on what your expectations are. The thing about nursing is you can parlay it into so many different areas. You can parlay it into, like I'm doing aesthetics now. People go into pediatrics, people go into geriatrics. Majority is in geriatrics, but there's more to that nursing department than just working with older people, older folks. You can go into education, which I did. You can go into into education. I'm also into aesthetics. There's so many micro departments and micro and macro areas you can work in. So it's something we can talk about, right? So again, remember, there's a private group now called Nurse Amy Learning Lounge. Nurse Amy Learning Lounge is a private group on Facebook. So go ahead and if you want to be part of that group, we're going to be discussing things like this. Your nursing career, where to start from and how to go, because this is things that I have helped a lot of students with, and I love it. I love what I do. So there's just so many things you can do with nursing. So is nursing worth it? Yes. It prepares you for how to manage not only finances, manage people, but also you can parlay it into various different departments. So it's been worth it. It has been worth it. You're going to get burnt out. The wear and tear is for real. I'm going to make this a part 2. I think I'll just tie it in. Nursing, is it worth it? 1, and then I'm going to do a second episode because this video is getting too long. And then the other one is going to be, what did I say what's going to be? Nursing will do that to you too. You forget things. Oh dear. But remember, I'm going to come back and do a part 2 of Is Nursing Worth It? Okay. And remember the private group Nurse Amy Learning Lounge. Let's learn together. Okay.